My name is Dr. Michael Carter, and I am a dentist. My clinic sits on a quiet street in the heart of town, with large windows that let in plenty of natural light. It's not a fancy place, just a waiting room with comfortable chairs, a small aquarium to calm nervous patients, and my treatment room filled with the hum of modern equipment. To most people, dentistry might seem like a mundane profession, but for me, it's about more than just fixing teeth. It's about helping people feel confident, comfortable, and healthy. Every morning, I start my day early. I sip a cup of coffee while reviewing the schedule for the day. Some appointments are routine cleanings, others involve more complex procedures like root canals or crowns. But no matter what lies ahead, I always remind myself of one thing: every patient who walks through that door has their own story, fears, and hopes. My job isn't just technical, it's deeply human. One Tuesday afternoon, a young boy named Ethan came into the clinic with his mother. He looked about 8 years old, clutching a stuffed dinosaur tightly in his arms. His mother gave me an apologetic smile as she explained, "He's terrified of dentists. We've been trying to prepare him, but..." "It's okay," I said gently. "We'll take it slow." Turning to Ethan, I knelt down so we were at eye level. "Hi there. I'm Dr. Mike. Do you like dinosaurs?" His eyes lit up slightly. "Yeah. This is Rex." "Well, Rex is very lucky to have such a brave owner," I said. "Would you like to show him around while we check your teeth? He can sit right here and watch." Ethan hesitated but nodded. As I guided him to the chair, I kept the conversation light, asking about his favorite dinosaurs and whether Rex ever had toothaches. By the time I began examining his teeth, he was relaxed enough to answer my questions without fear. When we finished, he even managed a small smile. "Thanks, Dr. Mike," he said shyly. "That wasn't so bad, was it?" I replied. "Next time, Rex can come back too." Later that week, an older gentleman named Mr. Thompson arrived for a consultation. He walked in slowly, leaning heavily on a cane, and winced when he sat down. "I haven't seen a dentist in years," he admitted. "But this toothache is getting unbearable." After taking X-rays, I discovered the source of his pain, a severely decayed molar that needed immediate attention. However, Mr. Thompson seemed hesitant. "It's not just the cost," he confessed. "I'm afraid it'll hurt." "I understand," I said. "Let's make sure you're completely numb before we begin. And if you need breaks during the procedure, just raise your hand. You're in control." As we worked together, I made sure to explain each step clearly, offering reassurance whenever he tensed up. By the end of the session, he looked relieved. "Thank you, doctor," he said. "You've given me my life back. I thought I'd never be able to eat properly again." Moments like these remind me why I chose this career. Dentistry isn't just about drilling and filling, it's about restoring confidence and improving quality of life. Whether it's easing a child's fear or alleviating an elderly man's pain, every interaction matters. Another memorable patient was Sarah, a college student preparing for her graduation photos. She came in looking anxious. "I want to fix my smile," she said. "But I don't know where to start." "Let's figure it out together," I assured her. After a thorough examination, I suggested a combination of teeth whitening and minor orthodontic adjustments. Over the next few months, Sarah visited regularly, and with each appointment, her confidence grew. When she returned after graduation, she brought a photo of herself smiling broadly in her cap and gown. "Thank you, Dr. Carter," she said. "I couldn't have done it without you." Stories like Sarah's inspire me to keep learning and growing as a professional. Dentistry is constantly evolving, with new techniques and technologies emerging all the time. Staying updated ensures I can offer the best care possible. But beyond the science, it's the personal connections that truly drive me. Of course, not every day is rewarding. Some patients are difficult either because of their anxiety, skepticism, or unrealistic expectations. There are also days when the workload feels overwhelming, and I question whether I'm making a real difference. But then someone like Ethan, Mr. Thompson, or Sarah reminds me why I do what I do. At the end of each day, I tidy up the clinic, sterilize my tools, and review notes from the day's appointments. As I lock the door behind me, I reflect on the lives I've touched, even in small ways. A child who overcomes their fear of the dentist, an elder who regains the ability to enjoy food, or a young woman who steps into the world with renewed confidence, these moments define my purpose. Now, years into my career, I still wake up excited to go to work. Every patient brings a new challenge, a new opportunity to learn, and a chance to make a difference. Some may see dentistry as just another job, but to me, it's a calling. Because when someone leaves my clinic smiling, whether it's a child holding his stuffed dinosaur or a grandmother savoring her first bite of apple in months, I know I've done something meaningful. And that's what keeps me going. Not the drills or the charts or the long hours, but the knowledge that I'm helping people live better lives, one smile at a time.